Our spotlight this week is on the Wayland Health Department during the COVID-19 crisis. We'll talk with Director Julia Youngins and cover many questions about her department's ongoing activities in response to the COVID-19. And we'll ask some detailed questions that we think you'll find useful. Joining us in the conversation will be Town Administrator Louise Miller, who's been heading the town's COVID-19 response. Louise, Julia, thanks for being here again and taking your valuable time to talk a bit about what's going on from the land of health. Let's start off with the first question I have is, what's the procedure you like to see people follow if they're feeling sick? And are there particular symptoms that you want them to call for, or just any symptoms if they're not feeling well?
Yeah, so thanks for asking that question, that important question, Ken. We think it's very important that people call their primary care physician as well as the Board of Health hotline. It's the coronavirus hotline, and the number is 508-358-6805. So, you know, some of the symptoms that people might have could be fever, cough, fatigue, sore throat, and some, you know, generic cold symptoms. Those things that, you know, in this day and age where we have widespread community disease, disease within the community and within the state, it's very important that we encourage people to continue to call us as the local Board of Health so that we can assist them and answer any questions that they may have, as well as encouraging them to contact their primary care physician to determine if they need to be tested or not.
Okay. So what will happen next once they've made the call? They're going to call their primary probably first, and then you want them to call you as well, right?
Yes.
The health department. Is that the same number, the 6805?
That's our hotline number for any COVID questions.
Okay.
Yeah, so that's a special number that you know, we check all the time, you know, including on the weekends. So
Okay.
if calling, you know, we will get that message even if it's on a Saturday or a Sunday.
Okay. And what will happen next once they call? And how do they get evaluated in terms of what the next steps are?
Sure. So if someone calls, I mean, currently we have a very wide range of questions that people have. It could be a general question, you know, which, you know, something that I might be able to answer, or, you know, my administrative assistant could, if it's just a general question about town services or where they can find information. You know, we might deploy the call to the front office. They've been very involved as well. If, you know, they start getting into questions about their symptoms and potentially being in contact with someone who might have been tested positive, then Ruth Morey, our public health nurse and nurse leader, takes those calls, or one of our community health nurses. But Ruth has been answering most of those calls herself.
Okay. All right. And where else can residents go from, as far as the town's concerned, for references to find more information about correct procedures?
So I wasn't sure what you meant about correct procedures, but we do have a lot of information on the town website, including all the CDC guidelines and recommendations that are listed on there and can be accessed there. So, you know, if someone has a specific question, they can certainly call us as well. You know, if there's a question about quarantine procedures or isolation or any other array of questions, we can either help them find the answer if it's not clearly indicated on the website.
Okay. And that's all on the website. It's on the main page of the website, just so people know. They don't have to go searching to find things. The main page will direct them. They have all kinds of listings there and will direct people to where they need to go for the questions they're asking. What should people do who need food or prescriptions but are afraid to go out?
So anyone who needs food or prescriptions and is afraid to go out should call our main general helpline, which is 508-358-7701. And we are manning that phone line 7 days a week. If someone doesn't answer live, we get all messages and we will respond right back. And depending upon what the help is that is needed, we'll direct them or provide the help ourselves. Right now, yeah, so right now for prescriptions, the drugstores are delivering most prescriptions, except for certain controlled substances, and there are other exceptions. And we'll have a police officer pick up prepaid prescriptions and deliver them. And then with respect to food, last week we put out a flyer with food pantry information as well as the town's food help.
I saw that. It's a long list and it seems to be a growing list. We'll have that up on our website so people can see it as well. Let me ask you another question. How should people handle food that they buy and that gets delivered to their home? Are there any special procedures, that do's or don'ts that people should be thinking about?
Yes, thank you, Ken. We do actually have a handout that we've prepared that is also on the town website. Basically, if you're going to the supermarket, you should wear a facial covering or mask if you have one. And ensure that you're practicing social distancing in the store, which I have seen. There are many signs and announcements over the loudspeaker at these supermarkets in Wayland that remind people about social distancing at the supermarket. They have things taped out where you're separated. No touching your face as you're doing your shopping. Some people seem to like wearing gloves. What I usually do is I don't wear gloves, but I don't touch anything until I use hand sanitizer. So you do your shopping, check out, and I like to use self-checkout because even less contact with people, if you're able to. You can do your own checkout and then get your stuff and put it in your car. And once I get in my car, I use hand sanitizer again. And then once I get home, I usually bring everything inside, wipe it down with, Clorox wipes or, wipes that you may have. Everyone has, a little different way of doing things, but I like to wipe down all my products that I'm purchasing. And if you're purchasing, fresh produce, make sure you wash it really well, let things dry off, wash your hands between all those things, and then put things away. That's basically.
When you wash produce, do you use any special preparation for that, or anything you shouldn't use?
Well, you have to use products that are safe to use with fruits and vegetables. I think what they recommend is using a scrub brush on, like maybe fruits that have a skin on them. It depends what you're washing, and making sure you're rinsing things really well.
Mm-hmm. Okay. Are there any specific procedures that businesses are now being required to follow if they're interacting with the public?
If anyone is feeling ill, they should definitely be staying home and not going into work. And also, as we keep repeating ourselves, call their primary care physician and the local health department, as well as the health department in the town that they're working in. So we have done a number of phone calls and emails to our local businesses in town to touch base with them and share updated guidelines from the CDC and the FDA, and keep in touch with them if they need anything. As far as surgical masks go, we are recommending that anyone who is handling food or is not able to practice social distancing in a store setting, they should be wearing a surgical mask as well, or a face covering. We have, gone over the recommendations that FDA has for extra cleaning and disinfecting, hand washing, and, repeating all those same things that are already part of food safety measures, especially, in the businesses that handle food, but to ensure that they're following protocols for social distancing with their business, encouraging them to do mobile ordering, ordering over the phone, and then people can just come and pick things up easily without interacting if they can do that. So those are some of the things that are recommended.
Okay. What about restaurants, the ones that are doing takeout or delivery? How can people be sure, or how sure can people be that the food that they're getting from the restaurants, the takeout food, the delivered food, is safe?
So currently the CDC does not, and the FDA does not look at food as a vehicle for carrying this virus. They would encourage, proper food handling techniques, and especially focusing on if someone's sick, they should be staying home, and all the protocols within a food establishment that are already in place are, more accentuated, I guess. They want, people to really be checking their staff regularly when they come into work. Do they have a temperature? They're basically being interviewed to find out how they're feeling that day. Do they have any symptoms? Anything like that. And if they do have symptoms and they're feeling ill, they should be staying home. So,
Are you, excuse me, are you folks monitoring those situations on a regular basis?
we're aware of something. I mean, businesses do not have to report COVID-19 to the local Board of Health if they have a positive test. They would be reporting it to the local health department where the individual resides in their hometown.
No, what I mean though, Julia, I'm sorry. What I mean is, does the town check in with these restaurants, for instance, to make sure they're following these procedures?
Right. So I had mentioned that earlier. So we have been in touch with all our food establishments repeatedly in the past number of weeks, reminding them about all these things, asking them if they need any supplies. And actually we have, as a town, delivered masks to a number of businesses that have accepted some of our donations to protect their staff while they're working and, being exposed to the public. So, we have reached out and been in touch with all our businesses a number of times.
So, and in my office, we actually, and the days, I apologize, the days and the weeks kind of blend together.
Yeah.
I think it might have been 10 days ago or so, contacted every single takeout establishment, grocery store in the town, and offered to deliver masks to anyone who requested masks. And we did do that maybe about 10 days ago. And it was a good supply of masks. We were very lucky. We have received donations of masks from very generous residents who have been able to get some for us. And we continue to do that. Today, we're going to be delivering more to other businesses.
Right. So we're sort of on the second wave of that. that was an initiative that
Right.
seems like yesterday, but wasn't. And, we reached out again, we've heard from a few businesses again, although, they're finding their way to be able to get access to these supplies more now than they were initially. So that was sort of, if you don't have access and you don't have anything yet, now it seems like, a lot of businesses are, being able to get their hands on some of these supplies, so.
Okay, great. Well, that's good information. Let me switch to a little different subject. What about residents at Wayland's public housing facilities? What's being done to address their safety?
So Brian Boja has been working since before even the state was shut down. He attends all of the department managers' meetings. So he's been working with us since we started on February 27th.
Brian what's his role again?
He's the executive director at the Wayland Housing Authority.
Okay.
So we've been working together now for 2 months. And all of the residents at the Wayland Housing Authority properties have access to exactly the same services as any other resident. In addition to that, we have provided them with masks and distributed flyers to every resident with information about how to get groceries, prescriptions, food safety handling. He's made a real concerted effort to get as much information as possible to the residents in those particular housing units. I know Julia wants to add.
I think you covered most of it. We had worked with the Housing Authority right at the very beginning of things, and, have kept in touch with Brian to see, if there's anything he needs. He just has to give us a call or stop by,
Okay. What about what's the situation? We've heard that there have been some number of cases at the assisted living facilities, the 3 of them in town, and the nursing home. What is the status at those facilities?
So currently we have had testing at our 3 assisted living facilities. The National Guard has visited Traditions and was also visiting Sunrise, I believe on Friday. And also at the Carriage House, they had a ambulance company come in and do testing over there. So all 3 of our facilities have been doing testing. Ruth Morey, our public health nurse, has worked very closely with these facilities regularly on a daily basis for different things that have come up, questions and, just guidance and information. So it's really a constant situation, that we're maintaining contact with them as we continue through this situation of, community spread of disease. And so, we're continuing with our work regularly.
Okay, that's good to hear. What's your outlook for the next couple of weeks, or how long do you think we'll be dealing with this level of high alert?
So I am on conference calls, at least 2 a week with the governor's office and then with other administrative and executive officers in town. And what we're looking at right now, and I'm hoping that the governor issues a statement soon, is I don't think we're going to be lifting the stay-at-home order on May 4th. That's actually just next week. And the information that we received is it looks like the state has plateaued in terms of number of new cases. And speaking with a number of epidemiologists, they indicated that what the state is looking for is the percentage of positives per total number tested per day to go down for 14 days in a row. And we've been holding steady somewhere between 24 and 28% of tests daily coming back positive. So the good news is we're not really continuing to increase the rate of positives, but we haven't started decreasing yet. So I think we're in for a little bit longer, and that would be in line with what other states are doing.
Just one observation or a question. I seem to remember that the number they were looking at as a plateau was 2,500 a day, and that it's only around 17 something a day. Is that accurate? Am I accurate about that? So that would mean that we're plateauing lower than they were originally expecting? Am I right or wrong?
We're plateauing a little bit lower. I think the total number of cases that are being tested per day hasn't gone up to the level that they thought it would. They thought it would be closer to 10,000 per day. And we haven't quite reached that 10,000 level. We're closer to 8,000 per day. So the number is lower. But for Wayland, what Julia and I have talked about is we're not going to change anything in Wayland prior to the state lift the stay-at-home advisory. So we think we have a ways to go.
Right. Yeah. I mean, I think Governor Baker, I don't see him changing. I mean, not changing the date. I see that being extended, and you know, we would want to err on the side of caution because there's so many things that need to be addressed. And you know, considering a reopening plan, there's a lot of activities, as I'm sure you're aware of, in town that people are going to be chomping at the bit to start with. And so, you know, we want to make sure we encourage people to continue practicing social distancing. You know, we encourage people to, and strongly urge people to wear face coverings if they're outside or if they're in a public place where they're shopping. There's a big concern for continuing to practice social distancing.
And, you know, from a practical perspective, with daycares and schools still closed, I'm not sure how non-essential employees would be able to physically return to work. So I think we're going to continue in this remote operation mode for a while, just, you know, logistics wise.
And for those who are in the high risk category, like for age, like myself, and or because of conditions, physical conditions, even when things are lifted, there's probably not going to be much of a change for those folks, is it?
It probably depends on where we get to with respect to testing, antibody testing, to determine whether someone has been exposed to the disease, just happened to be asymptomatic.
Yeah.
And
that's a big
That's a big issue.
Information that's very important that we should mention that, you know, right now we would say that anyone should be considered as possibly carrying the disease, because there's so many people that they're finding are asymptomatic, meaning they don't have any symptoms, but they could be carrying and spreading the disease. So, you know, just because Johnny is, you know, feeling well and looking healthy doesn't mean he is. If you allow Tommy to go play with him, you just never know. And so, you know, during the course of this scientific study of the disease, you know, there are different things they're doing in Boston now that is just starting. They're looking at checking antibodies and doing tests on a number of people, I think in Somerville, to find out, you know, what's going on in that particular area. And so, you know, we'll all be interested in hearing, you know, what they find and how these antibody tests work as well.
And until we have a certain amount of the population that has actually been infected, we always risk, as soon as measures are loosened a little bit, a surge again in total number of infections.
Yeah, and until we know more about how this thing works,
Yeah.
how it acts, reacts. I want to ask another question. What resources does the town have for residents who are having trouble coping with this crisis emotionally?
So our own resources, we have the youth and family services, and we had added staff time in order to deal with issues that residents may have. And that number is 508-358-4293. And we also posted a whole bunch of hotlines and mental health resources, domestic violence resources, and other social and emotional resources for families. And they're on the COVID-19 webpage. Under the tab is assistance for residents. And under that tab, we probably have about 20 different phone numbers and types of assistance that residents could avail themselves of.
Okay. All right. Is there anything else that you'd like to add that we didn't cover that you think is important to mention?
So I have one thing, because we're in the middle of a public health emergency, and during emergencies, there tends to be an outpouring for first responders, and they are absolutely on the front line. And in this particular emergency, there's been an outpouring for hospital workers and nurses and others. But the one department within the town that has put in probably twice as many hours as almost any other department per person is the health department. They have been working 7 days a week and easily 60 to 80 hours per week since the beginning of the COVID-19 public health emergency. And I just want people to recognize the level of effort and the level of dedication of everybody within the public health department. And we have a total of 10 or 11 employees.
We have, yeah, the community health nurses. Ruth has been, working her fingers to the bone, really, because she's, leading the whole contact investigation piece. So, she's really wearing the burden of a lot of that, us together, as a team, working on this. And, of course, Patty and Darren, doing their roles and, pitching in with other things as well. So we appreciate that. Thank you very much.
I just want to make sure that people do recognize.
Absolutely.
There's another department here that's really working very hard.
I'm sure there are a lot of departments that are working hard. And I've mentioned on an earlier program when we interviewed with the Council on Aging, and that I've noticed, and I'm sure many people in town have noticed, the hard work that everybody there is doing. It's been a tribute to your capabilities and the town's organization, and I guess a little bit of that goes to you, Louise, for being able to keep it all together, and for everybody too.
It's because she's like the glue that keeps it all together. So, she's really been working super hard and been an amazing support for us. So, we really appreciate everything that she does as well.
Maybe we'll put her in the White House.
No, thank you.
All right. Well, thank you both very much. We hope that things start to lessen soon. Probably won't, but we can all hope anyhow. And thank you for your time. Appreciate it.
Thanks, Ken. Yep.
All right.
Take care.
Take care.